Welcome back to Brainista, the podcast where we dissect the latest medical research to help you, the healthcare professional, stay sharp and informed. I'm your host, Adrian, and today I'm joined by the brilliant Dr. Anna, who is a bona fide expert in all things genetics and aging. Anna, welcome.
Thanks, Adrian. Always a pleasure to be here.
So Anna, today we're diving into some pretty fascinating stuff about aging, mortality, and what really shapes our health destinies. And I've got to ask, what are the impacts that our environment and our habits have on the genetics of aging? And if we could tweak our patient's environment, would we be able to extend a patient's life, irrespective of their genetic makeup?
Today, we're diving deep into a groundbreaking study titled Integrating the Environmental and Genetic Architectures of Aging and Mortality, published in Nature Medicine in 2025. It was quite the read. The study really unpacks how much our environment versus our genes influences aging and ultimately our lifespan. It attempts to quantify the relative contributions of lifestyle and environment, otherwise known as the exposome and genetics. To remind everyone, the exposome is the total sum of environmental exposures a person encounters throughout their lifetime from conception onward. It includes factors like air pollution, diet, chemicals, lifestyle choices, stress, and even social interactions, basically anything external that can impact health. Researchers study the exposome to understand how these exposures contribute to disease risk, aging, and overall well-being. The exposome is highly dynamic, while the genome is more fixed, but both closely interact with each other. If you want to follow along, the links to the bibliography are in the description.
Okay, so where did this exposome genome smackdown take place, and how did they set it up? Give us the background intel.
The researchers leveraged the UK Biobank, a treasure trove of data on nearly 500,000 folks. They then conducted what's called an exposome-wide analysis.
Exposome-wide? Is that like genome-wide, but for everything but your genes?
Exactly. Think of it as casting a wide net to see which environmental factors are linked to all-cause mortality. They looked at everything from air pollution to socioeconomic status. It's basically about quantifying and evaluating the accumulated impact from all sources of non-hereditary insult on a person's health.
So what did they measure?
Well then, they assessed the associations of those exposures with something called a proteomic age clock among 45,441 participants.
Proteomic age clock, it measures your biological age based on proteins in your blood?
Spot on. It's a way to see how quickly someone is aging, irrespective of calendar years. Armed with all this data, they sifted through countless associations to pinpoint the key environmental drivers of aging and mortality.
Got it. So big database, big data dive, fancy age measuring tool, and a clear mission. Sort out nature versus nurture in the aging game. All right, so what earth-shattering revelations did they unearth? Did the exposome knock the genome out of the park, or was it a more nuanced battle?
Well, prepare to have your socks knocked off, Adrian. The polygenic risk scores for 22 major diseases explained less than 2 percentage points of additional mortality variation beyond age and sex. The exposome, on the other hand, explained an additional 17 percentage points.
Wait a minute, so genetics is getting benched while the environment is racking up points left and right?
The balance shifts depending on the
huge,
specific
Anna.
disease. Polygenic risk explained a greater proportion for dementias, breast, prostate, and colorectal cancers, from 10 to 26%. But for diseases of the lung, heart, and liver, the exposome reigned supreme, explaining around 5 to 50% of the variation.
So, if I'm hearing you correctly, for certain cancers like breast or colon, genetics still holds considerable sway, which makes sense in my oncology clinic. But when we're talking about the big killers like heart and lung disease, it's the environment that's calling the shots. But how does this translate at the patient level?
Think of it like this, Adrian. Our genes might load the gun, but it's the environment that pulls the trigger. These environmental exposures create a cascade of biological changes, like dominoes falling.
Dominoes of doom. Sounds ominous, Anna.
Ominous, but also actionable. The study pinpointed some major culprits. Smoking, unsurprisingly, is a huge one. It's like throwing gasoline on a fire of aging, accelerating all sorts of damaging processes. Socioeconomic status also looms large. Think of it as a constant uphill battle. The stress, the limited access to resources, it all wears down the body's defenses.
So poverty isn't just a social problem, it's a biological sledgehammer?
Precisely. And then there's physical activity, or rather, the lack of it. Our bodies are designed to move, and when we don't, things start to break down. It's like letting a car sit in the garage for years. The engine seizes up, the tires go flat, and rust takes over.
All right, so it's a triple threat: toxins, stress, and stagnation. So what can we do about it in practice?
Okay, so based on this, 3 key actionable points. First, assess environmental risk factors. Proactively ask patients about smoking, socioeconomic challenges, and activity levels. Make it a routine part of your history taking.
Not just, do you smoke, but tell me about your neighborhood, or what does a typical day look like for you? Dig deeper.
Exactly. Second, personalized interventions. Smoking cessation programs, resources for financial assistance or stress management, and tailored exercise plans. One size doesn't fit all.
So we need to be prescribing community resources as much as we prescribe medications?
Absolutely. And third, promote early intervention. Emphasize the importance of lifestyle choices and environmental factors, especially during key life stages. Pregnancy, childhood, midlife. These are critical windows of opportunity.
It's not just about treating disease, it's about building robustness and resilience from the ground up. So, Anna, if we had to distill all of this into a single catchy phrase, something that our listeners could grab onto and remember, what would it be? Something we can stick on a billboard.
How about this? Exposome, the architect of aging. It's the environment that's really designing our health outcomes, not just our genes.
I like that. It puts the power back in our hands, and the patient's hands. But could we get even more direct? Something that really highlights the study's biggest surprise?
Okay, then how about exposome matters more than genome for overall mortality?
Boom! That's it. Short, punchy, and totally tweetable.
Exactly. Tell your colleagues that while genetic risk is important for some diseases like breast cancer and dementia, but when you zoom out and look at overall mortality, it's what you're breathing, eating, and experiencing that really matters. To summarize, Adrian, this study really throws into sharp relief the incredible impact of our environment, our exposome, on our long-term health and longevity. We've seen how it often overshadows genetics in shaping our overall mortality risk and contributes significantly to the development of many age-related diseases.
So, doctors and nurses, it's time to really get down to brass tacks with our patients. Let's look beyond just prescribing medications. Let's really start digging into the environmental factors that are impacting our patients' health. Let's talk smoking cessation. Let's talk socioeconomic support. Let's talk community, mental, and physical wellness. Let's talk about access to healthy foods.
Exactly. It's about empowering our patients to take control of the modifiable aspects of their lives.
All right, now that is a call to action that I can really get behind. Anna, this has really been fascinating. Thanks so much for sharing your expertise and shedding light on the exposome.
My pleasure, Adrian. It's a topic that I am deeply passionate about and that I think has real clinical consequences.
Disclaimer and bibliography in the description.